Hello everyone, welcome to today's live session with Dr. Michelle on. Oh, I'm so sorry, but Dr. Michelle Mann. Um, Before we quickly start the presentation, I just wanted to say that we do have a zero tolerance policy, so if there's any sort of discriminatory behavior in a chat or someone unmutes, I am entitled to kicking you out of the meeting, so if anyone is experiencing any sort of bullying in a chat, please private message me and I will gladly take care of that. So now we're going to go ahead and get started with our presentation. Welcome to Pre-Health Shadowing. So we are an international student-led, woman-led, minority-led nonprofit for medical advancements. We have closed captioning to accommodate students of all abilities and needs, and if you have any ideas about how we can be more accessible, you can go ahead and email us at info@prehealthshadowing.com. You could save us as a contact to keep us out of your spam and join our email list so you never have to miss a live session again. And if you want to go ahead and stay in the loop with our current events and sessions that are coming up, you can go ahead and follow us on Instagram and TikTok. Our ats are at prehealthshadowing.com, at prehealthshadowing for both of them. And because we host from all over the world, where are you calling from right now? Currently, I'm in California. You can go ahead and put that in the chat. And if you're interested in being part of pre-health shadowing, we are always accepting student volunteers, so you could go ahead and sign up using the www.prehealthshadowing.com/medical shadowing/volunteer. And we're currently looking for team members, so you can go ahead and look for www.prehealthshadowing.com/contact/join our team. And some of the roles that you can get within PHS are in the IT departments, lead of grants, lead of fundraising, and a lot of other amazing opportunities. And this is what the application will look like. And I will go ahead and put the link in the chat as well. And if you're a current high schooler, you can go ahead and join our high school training program, or HTP, which offers leadership plus healthcare education for pre-college learners. And that is also found on the Join Our Team section of our website. If you're looking to get published, you can write articles, reflections, reviews, and even success stories, and you could submit your writings to blog submissions on our website. They look amazing on your resumes, by the way. And if you can donate, we would highly appreciate it because we solely run off of the time and donations from our volunteers. We would really appreciate it. This is the QR code you can scan, and I'll be showing it in the end of the session as well. If you have any questions, you can type it in the chat. I will be asking them during the Q&A to Dr. Mann, and you can also put them during the session or in the end because we do have a Q&A session then. Make sure to take good notes because there is a post-shadowing assessment that's available for you to earn your digital certificate to confirm that you were here and you got your shadowing. And I do ask that you guys put your cameras on because that really helps create an environment that feels like shadowing. But yeah, without further ado, Dr. Mann, you can start.
Okay. All right, so I can begin? Yeah, okay, perfect. So hi, everyone. I'm Dr. Michelle Mann. I'm just going to share my screen here. All right, so I'm going to be talking about the world of optometry. I've been practicing now for 2.5 years, so I'm a relatively rookie, I would say, but I think I've done a lot in that 2.5 years. So I'm just going to kind of go over, my application process, how I got here, and what's my future looking like. So a little bit of my background. I'm an optometrist that now owns and operates a brand new clinic in Surrey, British Columbia, which is in Canada, those who don't know. And I'm actually in my brand new clinic right now. So I have like a little ear out for someone coming in. So I'm waiting for my staff. So if you see me kind of pop in and out, that's just what I'm doing. So yeah, it's been a very challenging but rewarding experience. I previously worked at Iris Optometry, which is kind of a corporate optometry, similar to perhaps like you guys would be familiar with like a lens crafter. It's more Canadian based. They focus more on ocular health and disease, but in a larger scale across Canada. I I just recently left there to open here. So that was a good experience. There's always pros and cons working with big companies, but I did definitely learn a lot. I'm a member of BCDO, which is basically a club organization body for optometrists in British Columbia. I sit on various committees for the following: Langley Hospital Memorial Foundation, which is, I live in Langley, so that's the hospital that's there, so I help with fundraising. The Township of Langley, I live in the Township of Langley. It's heritage, just being involved in the community. And the College of Optometrists of BC, which basically is another governing body that basically protects the patrons of British Columbia. So I sit on I sit on some of the committees there. Yeah. And so Mishe Optometry is actually what my optometry clinic is called, because my name is Michelle and my nickname is Mish. If you guys can check out my Instagram and website, and I'd love to get some feedback. I'm still kind of getting used to the whole Instagram marketing world, and I'm having a lot of fun with it, but I really am kind of going more boutique and very custom quality eye care, because especially in our field, there's a lot of online, people can buy a lot of things online, and we're competing with a lot of big box companies. So you have to kind of create a way to be more unique. And I think although online shopping can be very convenient, but we're missing that experience, right? That custom, that making that person feel special. So that's really what I'm trying to create here at my clinic here. So yeah, that's all the stuff there. So you guys can check it out. Let me know what you think. I'm actually very curious. Okay, so back to the basics. So eye exams are not just about one or two. I'm sure you guys heard that a lot when you guys get your eyes checked. We're in a field that we can actually see live vessels. So a lot of endocrinologists or people that suffer from major, diseases like such as diabetes, which affects microvessels, and microvessels are in your toes. Just give me 1 second, sorry. Sorry about that. So that are in your toes, your kidneys, and in your eyes. So that's why it's, primary care physicians always push their diabetic patients to go get their eyes checked, because, with diabetes, it does affect the microvessels, and we can see them. We can actually see them. And we can see other conditions like high blood pressure, cholesterol, and any autoimmune conditions, and a lot more other diseases as well. We are part of the primary health practitioner team. And I say that because we do work with like primary care physicians to ophthalmologists, to neurologists, to even rheumatologists. So it's really good to be part of that team mentality, because you're going to have to rely on one another. Like sometimes there might be a case like, lupus patients, their eye is super dry. Is there autoimmune condition being well managed, right? And so if you have that communication, you guys can work together as a team. Like, no, I actually took her off of that medication for a short period of time. Okay, that's why she's getting these flare-ups in her eye. So that's kind of nice to have that, cohesiveness with the team. Optometry field is very fortunate to have very advanced equipment, some of the coolest, equipment here, but you can't also forget not to go old school, right? So there's nothing wrong with going old school, although it is very beneficial to have technology. It makes life a lot easier and convenient for sure. But a lot of the times there is some things that I still do, like, I guess, old school. And I think you just need to, as much as we're advancing in one ways, it's important to still kind of know the old technique. So I always try to practice both so I don't lose that. And lastly, go with your gut. A lot of the times I'm like, is this what I'm truly seeing? And, a lot of times I am usually right the first time, but, when you overthink, and usually I find, like, even with women, we always tend to overthink a lot, but, always go with your gut, and don't ever be afraid to go back to your school notes or even books. Like, sometimes I think when you graduate from school, you think, okay, I know everything, and I know it looks bad to like go back to, resources, but no, like, go back. It's better to kind of be sure and do your due diligence as a practitioner. So education. So my undergrad was at Simon Fraser University in Burnaby, British Columbia. Bachelor of Science. My major was life science and biostatistics. In optometry school, I went to MCPHS University in Worcester, Massachusetts. Hopefully I should be able to say that right now since I spent 4 years there. And I got a dual degree in optometry, and I got my master's of public health. So yeah, that's pretty much there. And some extracurricular. So in undergrad, I really did a lot of extracurricular. I was in the Health Science Student Union. I shadowed a lot of optometry clinics. I worked at optometry clinics. I went to Ghana for Unite for Sight, which I believe is a non-profit organization, I think based out of Connecticut. But I went to Ghana. I worked for the city of Surrey, which is a municipal job as a lifeguard and swimming instructor part-time when I went to school. And I played soccer Division I women's league as well. So I was quite busy in undergrad, and I knew that my grades were, average-ish, a little better than average, but they weren't like outstanding. So I knew I had to beef up my application in other aspects. So I volunteered, and there were some other small little volunteer things I did, but these were the ones maybe that stuck out the most to me. So why did I choose optometry? I always wanted to go into the medical field. And when I was a kid, I had little holes in my retina. It's really not that big of a deal now learning about it, but I was always in and out of ophthalmology offices and optometry offices. And I felt like this was such a nice area of medicine where it's like, clean, and, you get to have this interaction with patients, and, you get to work with technology and medicine, and you still get a little bit of a work-life balance. It's not like you're on call all the time, or, so I thought this was probably a really good field for the lifestyle that I wanted to continue to live. And you get to work with other practitioners as well from all different aspects. So I thought that was really nice, like more of a team, because I come from soccer and a team environment. So I really like that aspect. So I'm going to go over some cases. The cases I've selected were actually some that I enjoyed during my rotations. They focus more on scleral lenses, which some, you guys might be in like your undergrad, you may not know too much heavy optometry lingo, so I'll keep it pretty, basic, but I really find these lenses pretty fascinating because a lot of people don't know about it. So, and it's a good incorporation of how we use technology and to design these lenses. They're not like soft lenses, they're scleral lenses. So I'll go over that. So this is case one. So scleral lenses, I'll just give you a back story. It's larger gas permeable contact lenses that vault over the cornea, which is the clear part of your eye, and rest over the sclera, which is the white part of the eye. And I'll show you a picture. So with that, it provides a smooth optical surface that helps correct vision issues for those that have keratoconus, which is a cornea disease. It's a cornea thinning disease, and other irregular corneas. So if you look here, so this is like the scleral lens would look like here. And this is like, you fill the bowl, it's called, with like non-preserved saline solution. And there's like a technique of putting it, but it basically creates this like, refractive layer that helps reduce some of the distortion that unfortunately glasses or soft lenses can't correct. So it's more unique in that way. And it really does vault over all the way to the sclera here, right? And even if you look at this picture, it looks very intimidating and like large. It is, but it's actually quite comfortable. Patients really, when they put it in, it feels like almost like a swimming pool for your eyes. So yeah, it's quite nice. So I had this 54-year-old Caucasian male referred by an ophthalmologist. He had post-radial keratotomy, which basically was this old way of doing refractive surgery, like LASIK or PRK. But back in the day, they used to like make like spoke cuts on the cornea to flatten it for those who were nearsighted. But they found, although it was good at that time, but years after, the cornea became very irregular, and we saw a huge wave of that. And so that's why scleral lenses are becoming more popular now, because to correct for those irregular corneas. He had no other issues, occasional dryness, no flashes, no floaters, no pain. So, and he was fit in a hybrid lens, which is basically like a hard lens and a soft lens together, which is another great option, but sometimes it has a certain capacity. So you might have to switch over to like a harder lens or a scleral lens or something a little bit more custom. So yeah, really had no underlying health conditions, no allergies, just had the RK surgery in the 1980s. And his best corrected vision with the hybrid lenses were 20/25 in the right eye, OD's right eye, OS is left eye, so 20/30. Refraction, that's basically what his glasses prescription is. So it's pretty significant, or moderate, I should say, astigmatism. But, you know, he could still get pretty good with the glasses and, you know, correction. So that basically tells us like, hey, if we can get him in this custom lens, we can kind of, this is like where we're aiming to get, because that's his best correction. And so this is just all these codes. I'll just kind of break it down. This is basically saying all other, like his eye muscles are good, his peripheral vision is good, his pupils are reactive. And so I kind of bolded in what we need to focus on is he has RK scars with neovascularization, which are like little blood vessels along the inferior scars. And I have a picture of that, so I'll just do that in a second. But these are just the lens. I know there's a lot of technical terms, but basically what this slide is saying is there were these, we had to design synergize scleral lenses, and these were the parameters that we use to help correct the vision. And we got them down like 20/20, which is great. And it was very comfortable, you know, and again, I have more pictures of the actual design to kind of show you. And then you basically, you know, check for, you know, is a patient comfort, and he will return in progress in January 2018. But that, at that time, that's what we were aiming for. Okay, yeah, so these are some of the pictures. So this is a picture of his actual eye and those like neovascular and the scars there. So it's kind of interesting. I actually took a picture and submitted it to the Contact Lens Today magazine, and they actually chose it as one of their featured pictures, which was kind of cool. So I was kind of proud about that. So yeah, this is how what I was looking at. And so that's why with these scars, it does make it very irregular and can cause a lot of halos and distortion. So that's why soft lenses wouldn't fit properly. Hybrid lenses probably do okay, but he probably gets a little bit uncomfortable. So scleral lenses, honestly, is probably the best bet. He got better vision, comfortable, happy patient. I'm happy. And this is the OCT is optical coherence tomography. We use it honestly more so you might be like when evaluating the retina and retinal layers, but we can do anterior pictures of it. So this is the actual lens. This is the liquid reservoir that we use, and this is the cornea. So you always want to leave about 227, around 200 microns of gap. You don't want it sitting right on the cornea because it would really irritate it. And we also take pictures of how the lens lands on the sclera, making sure it's not too tight or it's not too loose or too flat, I should say, so it's not moving around. So these tools can really help us, you know, design the lens and send it to our, our reps to be like, hey, do we need to adjust anything here? Because it looks kind of good on my end. But yeah, so these tools, like I'm saying with technology, really does make it better for us and even for the patient. Okay, so basically his assessment was a corneal dystrophy due to post-RK scars. So patient was fit with the scleral lens. We educated them how to properly care for it. And you always want to note that down because just in case if they're like, oh, you never taught us how to do this, or you always want to, I'm very known for writing a lot of notes and a lot of like, we did this, but I think it's always better to be on the safe side. So it's really good. It's important to have good documentation. So we've educated the patient how to care for the lenses. He was taught how to insert and remove the lenses, and so you always want to have that. But yeah, it was a good case. Yeah, so I just, the pictures were nice, so I thought I'd feature that. Okay, case 2. So this is another scleral lens case as well, but this was different because we had to do like a completely custom lens. So I'll show you that next. So he was a 24-year-old Nigerian male. He was sent from a cornea specialist for scleral lens fitting. He had keratoconus. He was diagnosed around age 13. One eye was extremely progressed more than the other eye. He was getting cross-linking treatment in his right eye, and we were doing a fitting in the left eye. So cross-linking treatment is basically a treatment where they use ultraviolet light and riboflavin to basically kind of stabilize the collagen structures within the cornea to prevent the cornea from getting thinner or protruding or for keratoconus progressing. So you use that to kind of help stop the structure. It's not going to go back, but just helps prevent it progressing. So that's a technique that we use, ophthalmologists usually perform this surgery. Okay, so again, pretty healthy individual, yes, wears glasses, but nothing significant in terms of medical or underlying health conditions. So his best correction with his glasses. So right eye was 20/30, left eye was 20/80, and you'll see the pictures how much the left eye has protruded versus the right eye. So again, so right eye, basically everything's pretty, peripheral vision's good, pupils are good, eye movements are good. With the right eye, he had corneal cross-linking scarring from the procedure he had, but the left eye, he had like keratoconus, like clear keratoconus, and he had the Munson sign, which basically is like when a patient looks down with keratoconus, it's like this V indentation, which I've shown here. So that basically tells us, that's a sign that's wow, the keratoconus has progressed, that he has a sign of like a Munson sign. And so what did we do next? This is not the patient, but that was just a picture I used. So Scleral lens works. So we did a Scleral lens workup, which included autorefractor, pentacam. We did fundus photos, which is a picture of the back of the eye. We evaluated the patient. So we were, I think, debating doing just a regular kind of scleral lens fit with our little kit that we have. But I think in his case, because this was so severe, we had to use an iPrint Pro. And basically it's using this kind of like clay mold, apparatus. And we put it in the patient's eye. It looks kind of odd and uncomfortable, but it's actually not too bad. Sometimes with some patients, if they feel like it would be too much, we can put an anesthetic, but we try not to, because it just kind of getting it in. We let it sit there for, a bit, and then we take it out, and it creates this custom scleral lens. It's really for those individuals that can't really fit those parameters of our regular fit kits, or they just have really, really irregular corneas that would be too hard in a regular scleral lens. So the iPrint Pro is a very good option, because we create the mold, we send it to the lab, and I believe it's in Colorado, and they use their like technology and equipment to create a very custom lens like this for this individual. So this is the pentacam scans, and this is the right eye. So again, pretty severe cone here, but he had the cross-linking done here. So this basically, think of it like a topographer, like elevation map, right? So it's super steep here in the red, flattens out here, again, super steep here, and kind of flattens out here, right? This is not normal. Usually normal is pretty uniform in terms of steepness and elevation. Think of it like a mountain, like when you see those maps where the mountain's really high, it's kind of like that. And this is the left eye. So yeah, again, pretty, dense cone here and steepness here as well. And again, flattens out. So again, obviously seeing this, we know it's a regular cornea. And again, the pentacam is kind of nice because it tells us the degree of variation. Yeah, his is like 73. That's probably the highest I've ever seen in terms of steepness. I'm just going to go back to his right eye. His right eye wasn't as bad. It was like 56. It looks a lot worse actually on the picture, but if you look at the case, that's why you got to take all the numbers. Don't just look at the pictures. You got to take everything. But I remember his left eye, like that was probably the steepest I've ever seen. So yeah, after they did cross-linking in the right, and we fit the iFit Pro on the left. Right eye was 20/30, and that was pretty much his baseline, so that was great. Left eye, he was a 20/80, remember, with glasses. Now we got him down to 20/30, which is great. That's like, so many lines of improvement, and now they're both kind of the same, right, with correction. So it's great. I think that's a good result. I mean, ideally, realistically, we would love to have everyone down to 20/20, but sometimes you just have to see what the baseline is and just kind of educate, and also educate the patients about their expectation of what they can achieve. So that's why it's really good to have an open communication with the patients. But so this was a good result for a young individual. Like, he's 24, he's pretty active, so he wants to be able to see. So I think this was a good result and a good option for this patient. So assessment, so it's keratoconus, cross-linking was performed in the right eye, iPrint Pro in the left eye. So because he was going back to Nigeria, we gave him all the forms for his optometrist there to continue proper care. And obviously, if he had any issues, he can always email us, or So it was a good case. All right, so those are the cases. I'm going to go over a typical day that happens in my day. It's quite different now being a practice owner. So I, wake up in the morning. First thing I do is check emails, make sure any important matters are attended to first, because I'm not only an optometrist, I'm also a business owner. So I'm wearing multiple hats. So one thing is making sure the clinic runs smoothly, but also the finances, all the, boring stuff, I guess, but that needs to be handled as well. So before seeing patients, I usually like to kind of get my staff together and go over the day. So basically what are we going to be doing today? What patients, how many patients, making sure we're on the same page. Are some of the orders that need to be made? Do we have everything? And just kind of going over a guideline of how today is going to go. So that way we're not caught off guard. Then we see patients that are scheduled. Now it's a bit slower just because I'm brand new and I'm starting from scratch. So we're just trying to recruit some patients. So it's been good. And the main thing is we're just kind of integrating our technology with our software. So just learning that. And then at the end, wrap up the end of the day, make sure end of day finances are balanced out. Then I attend to emails again, making sure everything's all taken care of, and lock up the clinic and get ready for the next day. So I usually try to, before I lock up, make sure everything's clean and what we need for the next day is already set to go. All right, so in my admission process, so I think for the most part, mine was probably similar to a lot of individuals, but I will say for me, my grades were pretty average, to be honest. I don't think I was like straight A's. I was probably a B average, maybe occasional A-ish, but I would say towards the first 2 years were definitely a struggle. Towards my third and fourth is when I made up for all like maybe not so great grades in my first 2 years. But that tends to happen because you find your major and you really like those classes. The first 2 years you're just taking prereqs that you have to take for whatever program you're taking. So that being said, because my grades I knew weren't going to be as strong as maybe some other applicants, I had to do a lot more supplemental stuff. So like volunteer work, join the clubs, made sure my references were good, like so even some professors that you have a good connection with, continue making, like, I know the term teacher's pet is bad, but you want to have those good connections because you want those references to be very personal. So you want those really do come a long way. And then even afterwards, it's always a good resource to have. So making those good connections and making sure you have solid references in my part really did help me. I would seek guidance from current optometrists if that's the field you're thinking of going. Wherever field you're thinking of going, make sure you reach out to them and ask them about their journey and what they went through. Because for the most part, everyone will have similar journeys-ish, maybe a little bit different. But I think the more information you get and the more questions you ask, and every practitioner, they may seem intimidating, but they're always willing to help because we've been through that. So we want to help you so you do avoid making mistakes that maybe we did, right? That's the reason why we went through the struggles we did. So you guys don't have to, you younger generation don't have to. So ask a lot of questions, reach out to people you want to reach out to. I think that's really important. And research the schools you would like to attend and ask those current students that are there how they like their program, because maybe they went in thinking it was something like, I really didn't like this part of it that, so like I'm happy that I went to the school I went because I think the practical, like we were in clinic like within the first semester of school, which I liked. And I think technically trained, I feel very confident. Whereas maybe some other schools, they don't start clinical stuff until like the third year of optometry school. So stuff like that, whatever is important to you, or if they have really good, strong research department and you're really into research, that might be something you should look into and research. Or if they have like a master's program, you can do a dual degree. That's also another thing that was very intriguing about the school I went to, is I liked that they had those options. And as a Canadian, I went to an American optometry school. We do have two in Canada. One is French speaking. I don't speak French that well. And the other one is in Waterloo, which is in Ontario. And it tends to be, their seats are pretty tight. And most of the optometrists that I worked with either went to Chicago, Boston, or Pacific in Oregon. So I think just kind of looking at what the programs offered, and those who live in the States, you're very fortunate. You guys have such amazing educational institute. You guys are exposed to a lot more, and I'm very grateful that I was able to go to a school in the States because I felt like I learned and saw so much, and just because you guys have the population for it as well. So so that was a different thing for me because I didn't go to a Canadian school. I went to an American school. Yeah, check prerequisites for schools because each school might be a little bit different. So like I remember one school wanted like a certain microbiology, but I took a different microbiology, so I had to like take that a different one. So whatever school you can, most of them will have the same one, but there are a few that want something a little different, and you want to make sure you've taken that class so you don't have to like do it in your third or fourth year. Like, oh God, I got to go back and do that class. So okay, when studying for my OATs, because there's MCATs or DATs, ours are called OATs. I took a lighter summer semester that summer that I was writing it, and it was the last summer before graduating. My school was a trimester school, so most people did go through summer classes. That was very common. So yeah, that year I did take a lighter load, and I used Kaplan, and I treated it like a job, literally treat it like a job. If you're lucky enough to take a semester off, take a semester and 9 to 5, go to the library, go to wherever you study and treat it like a job. I think that's probably my best advice. It really does. If you take it seriously like a job, because it is kind of serious, I think you'll have success. I performed okay on my OATs, and I'm like, you know what? I already have everything lined up. Let me just apply with this and see what I get, right? If I knew I didn't get in with my OAT, I'm like, I would have redone my OATs test, but I was able to get in. So then I was like, okay, good. But I knew if I didn't, then I was already mentally preparing myself to retake the OATs. Yeah, like I said, make yourself a schedule and treat it like a job. That's the more organized you are. I know it's you probably hear this time and time again, but it really does help and makes you less stressful too, right? You're not having to always think and yeah. Advice, do your research and find good mentors. Before applying to a program, you want to make sure this is the right career path for you. So really make sure whatever path you go through or whatever job or career you want to go, you really want to do, because especially anything with medicine, it's a lifelong commitment. You're going to be in school pretty much, we're still, even I'm done, but we're still always doing continuing education courses, so you have to really have the stamina for it. Evolve your study skills. So your study skills, that's the biggest thing. It's going to change. How you studied in high school is going to be very different. How you studied in university, how you studied in university is going to be different. How you studied in graduate school. It always changes. It's not going to be the same. So be willing to adapt to that and be able to be flexible in that too. That will change, and that's okay. Stay focused and make a vision board. I made a vision board, and my younger sister, she's she finished dental school. She's a resident at UCLA, and that's one thing we both kind of did, made a vision board and wrote it down like all the time, had it in our mirror, in our washroom mirror, saying, I'm going to get into optometry school. I will be an optometrist, and even put like on my lock screen on my phone, I had like the logo of the school I wanted to attend, like for that whole year, just so the more you see it, the more it becomes real. So really, I do really believe in like visualizing and putting it out in the universe. Do not get discouraged and keep going. A lot of times you will have setbacks. It's okay. Just keep fighting through, because this is not an easy journey. It's not meant for everyone, but it is very rewarding when you're done and you're at the end of it. So yeah, just keep pushing through if this is truly what you want, and don't let anyone discourage you. So that's why it's really important to have a good network of support people that are pushing you to, and I was lucky that I had that. So just really surround yourself with positive people. Lastly, go with your gut all the time. Go with your gut. And even with business, I've learned that, like setting up my own practice here, go with your gut. We have a gut for a reason. That feeling is there, so listen to it. So yeah. All right, thank you. And any questions I'm willing to ask. So yeah, or willing to answer, sorry, yeah.
All right, so we actually have till 11:30, so this is like a very long Q&A session. So make sure to ask as many questions as you like.
Yeah. Was there any other field you wanted to go into in the past? That's a very good question. I think I wanted to become some type of surgeon. I thought working in that hospital environment and that fast pace and I think that was something I kind of grabbed. But, if you ask any surgeon is a very long process. They do a lot of schooling, a lot of training, and I just don't think I had the stamina for it. And, their life is very up and down, like they're always on call, and it takes a certain mindset for this. So I have a lot of respect for surgeons, because when I was working at the VA in Salt Lake City and I would see the residents that were surgeons there, like, they were so tired all the time. And so I think, that was probably maybe one thing, but, doing your research and seeing how much time and commitment is involved. And it was like, okay, maybe not so much then. So that was another field. Okay, I was wondering if you can talk a little bit about the differences between older technique versus newer techniques. Great question. So actually, I'm lucky that I have some stuff here. So I'm sure in optometry clinic, you've seen like an autorefractor. It's basically a machine that you look into. You might see a balloon or a house that gets your baseline prescription. So that's been great, awesome. But then here we have a retinoscope where we use light and the phoropter, which is the lenses, to also get your prescription. I think with kids, this technique works well because a lot of times with the newer equipment, they may not fit or they may not focus on what you're supposed to be focusing on. So stuff like that, although, because some of those equipment and machines are really meant not maybe for little kids, they're meant for like an average individual. So that's why it's important to be able, and a lot of times there's going to be technical difficulty. So you got to go older. You got to make sure you have your old techniques. So I think that's like an older as a retinoscope. A lot of people don't do this. Or there's some other ones that are very invasive. That's the thing with older techniques, they tend to be more invasive and more uncomfortable for the patient. There's another actually equipment that I have here. I'm sure you've heard of the puff test, a puff of air. Everyone hates that one, but now they've come up with this one machine called the eye care, where you basically install a little probe and it moves really quickly to check the pressure. It's a lot more comfortable. Patients prefer this over the puff of air. So, things evolve. And again, the oldest technique of this is actually applanating the cornea to check the pressures, which is again, very uncomfortable. So I think the biggest difference between older and newer techniques, the newer techniques are more patient friendly versus the older techniques a little bit more invasive. Very accurate still, but just a little bit more invasive. Yeah, great questions. What age groups do I work with? I work with, so in Canada, it's not like in Canada, we do have like a public healthcare system. So under 19 is covered by the government and over 65 is partially covered. So I kind of work with all. There are optometrists that work more specifically with kids. I personally just like to work with all of them. I don't like to see, I don't want my whole day being just kids, or I don't want my whole day just being seniors. It's good to have, because every individual, especially with kids and seniors, do take some time and different energy. So I like a mix. So I wouldn't say I specialize in a specific or I focus on a specific group. I kind of welcome them all. I do like contact lenses. I like fitting contact. I like helping people see with the contact lens, making sure it's comfortable. And some of the machines that I bought are catered towards that. Whether it's soft or, wanting to do a little bit more hard. But yeah, so I work with all age groups. With kids, sometimes it can be a little bit challenging, not going to lie, especially the infants. So sometimes if I feel like I'm not, it's a little bit difficult, I'll refer them to like a pediatric ophthalmologist, especially if there are some concerns with the parents. Yeah. Okay, I am a little confused about scleral lenses. Do they improve a person's vision, or why did the OD and OS change from glasses to scleral lenses? Okay, that's a great question. So scleral lenses do improve the vision. They also improve aberrations or halos or glare that perhaps glasses don't correct, because glasses sit a little bit further out. Scleral lenses sit right on, which creates with a bowl, which creates a refractive layer that helps eliminate some of the glare. So yes, it does help reduce the vision more so than glasses. So perhaps, again, I apologize for my presentation. Maybe it was a little bit too heavy medical jargon, but yeah, those corrective visions that you saw before were mostly from their either glasses or their previous contact lens. Maybe they're wearing a hybrid or a soft. And then the last one that you saw after was what they were achieving with the scleral lenses. So we would never fit a scleral lens if it was giving worse vision, right? We always would if it improves the vision. But vision is one aspect, but also just the overall like clarity and the reducing the aberrations and halos. That's another aspect of scleral lenses that it does correct. So hopefully that answered your questions. I could answer a little bit better if you're still confused. But yeah, scleral lens is still kind of a newer age of lenses that people still don't understand, but just how it's designed is able just to eliminate a lot of the glare, because when light goes in, it goes to your cornea. If your cornea is already irregular, light's going to go through the cornea and scatter a lot more. So it helps kind of reduce some of the aberrations, I would say. That's probably the biggest thing. It just helps reduce some of the aberrations, glare, and helps correct the vision. Okay, how do you handle rude patients? So that's a very good question. With a big smile. You can't let them see you sweat. You have to just yes, yes, yes. The masks really do help too with COVID, so that's nice. So they don't see so much of your frustrations. But yeah, it's very difficult, but you have to, especially in the day and age of social media. Like sometimes, someone might go out and just do a whole social media rant. So you just gotta take it in and just smile and just be yes ma'am, no yes sir, and just you can vent, maybe work out afterwards, I don't know. But that's the biggest thing I would say. Okay, can you talk a little more about your OD MPH? Oh yeah, absolutely, I loved it. So so how it worked was in the first year of optometry school, it was all optometry. Then they started introducing, on top of my optometry course, we would do 1 or 2 public health courses. So they were mostly online. There was one semester when we had lighter optometry load that we would have to go in for one weekend for public health courses, like a seminar. But I really enjoyed it. I had to do like a research kind of thesis-ish. We had to do individual research and finding journal articles, and I really liked it. But the thing is, doing a dual program is very time-consuming, and the thing is, I liked public health, so for me, I enjoyed it. But for those that kind of just did it, I found a lot of my classmates that really weren't into it struggled a lot, or like it was just really taxing on them. So for me, I enjoyed it. So it didn't really feel too much like work. Mind you, like after finals or midterm week, when everyone's like relaxing, us public health students had like a paper due that weekend. So it is, you gotta be able to balance, but I really liked it. So I would advise you, if you're not really into it, don't do it, because it does take some time commitment. But if you really like and that are interested in that field, it's great. I really advise it. What devices do you have behind you, and what do they do? Very good. Oh, sorry. I'm just going to put that on silent. Okay. Yeah, so this is the slit lamp here, which helps me. It's kind of like a big microscope. Helps me see inside the eye, the cornea, retina. So this is just like a big microscope. It's nice. This is the phoropter. It's like an electronic phoropter. So I have like basically hopefully you can see a machine here that I can do the 1 and 2 stuff here. So, and then the letters show up on top there. So I kind of went all electronic here, just the way the world is working. It makes it a little bit easier. So that's the phoropter, slit lamp. The phoropter, I have a little iPad thing that I can change the lenses. That way I can kind of say a safe distance as well, but also it's kind of cool. Patients can I can put their old prescription in automatically and then switch it to their new prescription right away. So patient can get that experience. How was your clinical experience in doing? Oh yeah, great question. So my clinical experience, I had 3 long kind of rotations. One was in Connecticut, which was at an OD and MD practice, so there was an ophthalmologist. One was in Houston, Texas, and the other one was a VA hospital in Salt Lake City. So our school required you to do a VA, you had to do 1 VA rotation. So the Connecticut one with the OD MD practice, we saw a lot of like post-op cataract surgery. It was great. It was very, we saw a lot of stuff like disease, which is great, but we didn't get a lot of hands-on experiencing because they were always so busy. So they really use us as students as kind of like techs to help them. We didn't really get to do a lot of hands-on stuff. It was more so observation and perhaps just taking some notes. So it's with OD, MD practice, depending on where you get picked, the one that I was at, they were so busy that they don't think they had the time to really educate us on or let us be independent. We were just really just like as assistants. That's what it was. The Houston, Texas, that's where we did a lot of the specialty lenses. I absolutely loved it there. It was amazing, best experience. I almost wanted to move there, and I learned a lot. And I had such a great mentor, and I still talk to him till this day. So that's great. It was amazing. So we did a lot of scleral lenses, specialty lenses, and he was a practice owner himself. So I learned a lot of the business side as well. So that was so I tried to pick my rotations a little bit different, like all aspects. So I had heavy disease with the ODMD practice. I had contact lens specialty in Houston, and then VA hospital was kind of more disease, but more so diabetic as well, and macular degeneration, and working in a big hospital setting. So that was good too. And that VAs are more designed to work with the students. So that program was really nice. So that was good. When did you recommend start studying for the OCT? I think you mean OATs. Do you recommend people to start during their sophomore year of college or junior year of college? Great question. So I think you can always start early, like I was saying before, like when you're in school, the first 2 years, when you're taking your biology, when you're taking your chemistry, when you're taking your physics, that stuff is in the MCAT or OATs or DATs, right? Those are the prerequisites. Everyone has to take that. So don't forget that you don't have to like if you're studying it in school, it's going to be in your brain somewhere in there, right? So I would say maybe start off like the earlier the better, but maybe carve out like once a week, just going over some flashcards. I'm a flashcard person. I like flashcards, right? And then slowly as you're getting into your last years, maybe picking it up a little bit more. But I think for me, it's easier said than done to be like, let me start earlier. But for me, I'm a visual learner. I like to be more hands-on. So I think even shadowing or having a job in that kind of related field would help too, because you're learning it and you're seeing it. But yeah, I mean, the earlier the better, obviously, but I wish I did that, but I didn't. So I just took that one semester lightly and I just kind of buckled down and did it. But I think if you're wanting to start early, don't like overwhelm yourself, because maybe start just doing like little flashcards, like maybe like every Monday is like, or Friday, I don't know, whatever you guys choose, is like you go over like before bedtime, like flashcards or something, like maybe 20 a day or something, or 20 a week. I don't know, something like that to start off easy. And that repetition is good. Yeah. Yeah. How did you find opportunities to shadow doctors, or where did you volunteer? Great question. So with the student union that I was involved with, they always would post about volunteering options. A lot of it was like if there was people, I kind of reached out to some optometrists, like I would like Google them that lived in my area. I'd be like, hey, I'm a student, I'm interested in optometry. Is it okay if I shadow you? And honestly, a lot of them were like, yeah, sure. Because we've all been there. Like if I had a student to ask me, I'd be like, yeah, of course, come in, like no problem. So that's kind of what I did. But the volunteering, it was mostly, I think, from school. Like they would always post about certain, and I would say yes to everything. Like, yeah, sure, I'll do it. Yeah, sure, I'll do it. And I was lucky that a lot of my friends were involved in clubs too. And so, we would always help each other out with volunteering opportunities. But yeah, that's how I would find them. It was through my student union, for sure. Yeah. I'm just going to talk a little bit more about the MPH, the Master of Public Health. What did you like about your school? Okay, and that goes with the MPH. So I liked my school. What I liked about, there's certain things, every school you go to, when you've done, you're like, oh, I wish I went to a different school if this happens. But what I liked about my school is that they had those dual degree programs. Doing my major in life science and biostatistics, I was already kind of well versed in public health courses. So it just kind of amplified when doing the a master's of public health, and it helped me kind of understand certain journal articles or when you are doing certain research or looking at certain studies. You're able to see it with a different lens when you have a public health, and you're just able to look at all aspects of health, not just one optometry lane, all aspects of health, I think, which is super important. My school, I liked about it, it was smaller class sizes, which was good. And I looked at their, I was lucky because obviously I interviewed like way before, like in 2013 with COVID. I know before like COVID. So I know like with COVID, people had to do like online interviews where you didn't get to actually see the school that they were attending. I was lucky. Obviously, I got to visit in 2013, and they had the latest technology. They had enough exam rooms, so I knew that I would have that one-on-one training, where some of the other schools had quite large classes, and some of the classes had to be split, or they had to watch the seminars outside in this waiting area. So I was like, I don't know if I really want that. So class sizes were a little bit smaller, about 65 to 70-ish. And I like that they implemented clinical pretty early on. So I really liked that. But I would have to say, because it was a newer school, there was always a little bit of like, not politics, but there's still, always things are always changing. But the people that I met at my school are amazing. They're lifelong friends. So ultimately, although yes, there were certain things I would like to change, but I think ideally I went to the right school because I met the right people, and those people have helped me a long way. And also I was able to do those rotations. So things always work out the way they're supposed to. So I'm happy. The main reason why I went to that school was their public health program, the dual degree, and the early clinical aspect of it. Okay, how strongly do you recommend doing a residency? That's a very great question. I didn't do a residency because coming to Canada, residencies are great, but in Canada, it doesn't have much of a play, I guess you could say. An optometrist that has a residency, it's not like they're going to get to work at like some fancy place here. In America, I think it does have a bigger pull because you can go into teaching, you can work at a VA. So, if I was staying in the States, perhaps, like I always kind of go back, I'm like, I wish I did like a specialty lens, contact lens residency, but, it's pros because then, you don't get paid as much as some of your friends that get graduate right away, but then you get that experience, right? And you get that, I will have to say most of my friends that have done a residency have not regretted it. I just think coming back to Canada, it really didn't have much of a play, but you can always teach yourself a lot of this different things too. So yeah, so I would say if you're planning on staying in the States, I think you have a lot more options with the residency. It's not a bad thing, it looks good, but it just depends also on what your opportunities are after you graduate as well. What made you want to open your own clinic, and how was that process? Oh, that's a great question. So I actually was very hesitant of opening up my own clinic because I only been practicing for a couple of years. I didn't think I was ready. I wanted at least 5 years. I wanted to buy someone else's already existing practice, but this opportunity presented itself. It was a brand new clinic, and right beside the clinic, a dentist was opening up, a physical therapist was opening up beside them, and then there's a medical clinic just down the street in our whole complex. So the only thing that was missing was a optometry clinic, and there was one other optometrist thinking of buying it. And so my family was like, I think this is the time you should do it. So I just bite the bullet, and I did it. And it's been very challenging, let me tell you. A lot of delays, especially with COVID, with construction, and just everything, even some equipment delays. But it's really nice to have that aspect that I have complete control of everything. And I get to design things the way I want to design things. It's definitely been challenging, but very rewarding. I will say my biggest challenge right now is hiring good staff. I have one staff member who's great, but finding good staff at this time, I think it's really hard. There's just I think there's a lot more jobs than there is individuals that want to work. Does the ease of opening a clinic differ in Canada and the US? I don't know. It depends. It's hard to say because I haven't opened up a clinic in the US, and some of my friends that have I think they both present in different ways. And also probably depends on what state you're kind of opening it up to. But I think everyone kind of faces the same kind of challenges. Like I think construction is probably the biggest delays of certain supplies. I think if anything, maybe just like I had to work with a college of BC of Optometry, making sure my licensing was all in place and like I was able to operate and making sure the names, like there's certain like legal stuff like that that probably is a little bit different from Canada and the US, but I think in general it's probably somewhat similar. But I think in the US, I know each state is quite different, whereas Canada generally it's pretty similar across provinces. But yeah, I think in any way of opening up a brand new clinic from like no patient base is going to be tough for everyone. Like it just is. That's why it's a lot easier when you can buy an already existing practice that already has an established patient base. It just makes it so much easier. You don't have to worry about the overhead. You know, here I have a lot of overhead because I had to buy everything pretty much new, right? So yeah, but I'm excited. How do you get patients as a private practice? That's that's a great question. You know, social media, word of mouth. I don't want to ever come across too corny either. So at this moment, I'm in my soft opening phase where I'm just basically telling friends and family to come in. So if there are any technical issues that I can kind of work out before I actually see, you know, more people and more patients. But yeah, just word of mouth. Social media is huge, you know, Google reviews, like all that stuff. That's the day and age we live in. What advice would you give someone who does not know what practice to get into? Yeah, that is I think, you know, that's a good question. Whatever, I would say if you're interested, let's say if you don't know, just start somewhere. Like, let's say if you're interested in, I don't know, sciences and research, go volunteer somewhere there and see how you like it. If you don't like it, like for example, my dad's an engineer. I thought I was going to be an engineer, or he thought I was going to be an engineer. That would have been the easiest thing. I used to work in his office when I was 16 and I absolutely hated it. It was so boring. So I knew that wasn't what I wanted to do. So I mean, I think stuff like that, or if you think you're going to go into a world of finance or accounting, follow them for a day or two and see if that's something you would want to do. I think that's the best way. Like how you guys have this pre-shadowing thing. I think that's great. But you know, really that's the best advice I would say. If you're not really sure, just kind of dabble and put your foot here and there and see if that's something you would be interested in. That's the best. Is it a big deal if you decide not to work corporate or retail and would rather go into a hospital? Right. That's a good question. Not really. Like a lot of the times like some people will do both. Some people will work at I'll speak more specifically for the States. Like I have friends that work at the VA hospital and then also like once a week or twice a week will work retail or corporate, because unfortunately with corporate and retail you do get paid pretty well, and a lot of times they do make it very enticing. They'll do sinus bonuses and it just makes it seem like, but you're also dealing with a lot more politics with it, whereas hospitals you're dealing with a lot of heavy disease but maybe the payment compensation is not there, right? So I think if coming out of school, if you can kind of do a little mix of both, and most like being an optometrist, that's one thing, you can kind of work in all different locations. They're not going to be like, no, you can't work there. So I think, I think that's if you could do a little bit of both, I think you'll get a better grasp of which way you kind of want to go instead of just putting all your eggs in one basket. Do you have any codes in your office, like red code and such? Not really, because we don't really deal with too much heavy code issues here. It's not like a hospital. If that's kind of what you're referring to, hopefully that's what I'm answering it correctly. If there is any kind of major issues, like if there's a retinal detachment, I usually just will call the on-call ophthalmologist. It's a little bit different here in Canada. Like my practice, my clinic is very boutique type, you know, ocular health, clinic. So, you know, we don't really see too much heavy, crazy stuff here. What is something you would improve about the medical field? I think the bedside manner and I think a lot of times, although like, you know, if you're a great test taker and you're smart, but having that connection with the patient, like some students or some, you know, practitioners are very intelligent, super smart. They probably got all A's and did the best, but they lack that compassion or that bedside manner. So the ability to talk and communicate or convey what they're wanting to convey to their patient. And then some patients are completely turned off. Sometimes you may not even have to be the smartest like practitioner. But if you're just willing to go the extra mile, that human connection, that ability to talk goes a lot longer, right? Some patients do care that, oh, their practitioner went to the best school and graduated top. Great, that's amazing. But if your practitioner not willing to go the extra mile, then it's better to have someone that's willing to kind of communicate with you and work with you versus just so that's probably what I would change, is maybe and hopefully the schools would teach you actually two things: better communication to patients and bedside manner, and the business, because even if you're in like being a physician or surgeon, there's always a business component. My school, they did a little bit of business class, but optometry is pretty heavy business. I wish they taught us how to like bill, like how to be lucrative in billing, or just in general, like how to handle all that. Because I'm so medicine that the business aspect, it gets kind of confusing. So I wish they incorporate that into their program. They really should, because even I work with an ophthalmologist a couple days a week. I do his post-ops, and we have that discussion all the time, because although he's a surgeon, he still has to like think about numbers and all that other stuff. So I think that's probably what I would they need to incorporate. If a person does medical school in the States, can they practice in another country, or how did that process work? That's a great question. So I'm lucky with optometry that my province does accept American boards. So I just literally have to do my American boards, because again, in Canada, there's only 2 schools, right? So we have like a North American like optometry association. So I just had to write my American boards and then just do my licensing exam here. That was it. Some provinces do require you to write a Canadian boards, like Alberta, Saskatchewan. I think most other provinces, I think BC and Ontario are the only ones that don't. I think some provinces are starting to kind of like open up to American boards. But yeah, so it wasn't that hard for me. And I think for other areas of medicine, I'm not too sure. You might need to write some type of conversion test. But usually if you go to school in the States, it's not, and you want to go back to Canada, it's not that really that big of a deal. You just have to write a licensing exam. You also spoke about being part of a board or something of that kind. Do you feel that it helps you take time away from your practice? It is very time consuming. I'm lucky that I do have the time. I don't have kids. I'm not married. So I can, I feel like as a female, especially one of, a minority female, that is important for me to take the time and do those things and show my presence in those areas, whether it's like committee boards for the hospital or the township, because I want younger girls or just younger individuals of minority background to know that we can do it. We're here. So yes, it can be time consuming. Sometimes there are days I'm really tired and I just want to go home, but I think I have to look at the bigger picture, and that gives me more energy. So yeah. Okay. Do you have a medical journal? I know in NHS, they provide the residents with journals. They use someone as a diary to jot down any interest. Yeah, I did. I had like a little black book, because we would always have to wear a white coat. So I would have a little black book. And so sometimes if there are certain things like my preceptor said that maybe I didn't really know, I'd write it down. And so then I would research it afterwards. But yeah, I think that's a great thing to have. One time, funny story, my black book in Houston was in one of the scrubs, and I left it at that surgery, and I was like, no, it has all my notes, but they found it and they mailed it back to me. So that was kind of nice. So it's good to have those books. But yeah, since you also spoke about being a minority female, do you feel the need to try and outperform the stereotypes of women and minorities in the medical? I know you said a little. I outperform. I'm a pretty competitive person in general. I just want to do well. Like I just wanted to the best. I don't think I'm competitive with other individuals, but I think it's important just to do your best and just let your natural ability shine, because that will speak volumes. I'm not about like tearing other people down. I just want to do the best and just again show my presence, because if you do good work, your work will show for you. People will talk about it. I think word of mouth is probably the strongest thing that's out there. So but I think it is important for people of minority backgrounds to, do the best that they can to be in those areas, to show other younger generation that we can do it. And, hey, that person looks familiar, they look like me, I can do it too. I think that's huge. But yeah. How many patients do you see on a typical day? Does that vary by mode of practice? Yeah, it does. So now that I'm in my brand new practice, it's not as busy as I'm used to, but I'm sure it will pick up. But usually I would say like 8 to 10 a day, like full eye exams, sometimes more, sometimes less, just depending on the day. But like I was saying, I do work with an ophthalmologist a couple of days a week. I see his post-ops, and there I see about, let's say, 36 patients in an hour or so, or an hour and a bit. And so it's like boom, 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 seeing their exam. But it's a very different type of exam because you're literally just checking to make sure the lens is in place and there's no major inflammation or red flags at that point. So it's completely different. Full eye exams, unfortunately, you can't do those in 5 minutes. You just can't. So whereas post-ops are a little bit more flexible, so you can squeeze in a lot more patients. How do you study? Any tips, hacks, or resources, or people aren't familiar? Yeah. Like I said, I'm a cue card. I like writing things down. I'm very repetitive. One thing I will say is that sometimes I had the habit of studying things that I already know. Like I felt confident. I'm like, oh, I already know this. I'm going to study it. If you know it, put it aside. Study the things you're weaker in. Each week, you should kind of, when you're doing, and don't be afraid to do practice tests. Those are, sometimes people feel intimidated because I'm not ready to take them, because that will tell you what areas you need to focus on. So I would say with your MCAT, make like whatever day you're going to take, let's say you're going to take the test on like a Tuesday, weeks leading up to it, that Tuesday, you should take a practice test every week, right? Leading up to it, and situate it like how you would gonna take it, like wear the same clothes, eat what you're gonna eat that day, make it routine. And yeah, I'm a cue card person. I like writing things down. So I'm a bit little old school, and we're lucky we have like YouTube, Google, all the other different resources. Watching videos really helped me. So if I don't know, back in the day with Kaplan, they kind of had little videos. I'm sure they have that now. That was really good. Listening to it, if you're working out. But sometimes, like for me, like a lot of people like to go to the gym and listen. I like, if I'm going working out, I like to just have my mind empty. So that wasn't really for me, but cue cards and watching videos. I think for me, like going to the library like 9 to 5 and just studying, that was probably like making it a job. That really helped me. Can you talk about med school life? What did you do in a typical day? Yeah, I really did not have that fun of a med school life. It was just basically study, and we would have class pretty much like from 8 till, let's say, 4:30 or 5. And then after, we would either go back to the clinic and practice if we had a proficiency or if we had to study. So that's pretty much what it was. And then weekends, we would go back to the school and practice again, and practice our clinical skills. Because a lot of times we would have proficiencies, which are basically exams about testing our skills and abilities. And those were kind of split up. So we always felt like I always had clinical practicing to do, or obviously studying for a test. So yeah, pretty much typical day, Monday to Friday, full day of class. Obviously, you have a lunch break, and then after, we would either go back to the clinic. Like I had a group of friends that was like my study group. That one was my roommate. We all just worked together, and then maybe Friday evenings we go in the practice a little bit, and then go back to our apartment, just chill. It is always important to have a relaxing day. You don't want to overexert yourself. But yeah, I didn't like. I joined a club, like a like co-ed soccer team, because that really makes me happy, and that was important to me. But that was okay. But everyone, like our programs, like I was in a school that had pharmacy, had PA, had PT, nursing. So all of those schools had the same type of like intense program. So it wasn't so much of like, I mean, there was people that like definitely did enjoy, and but where we lived was very much a school town. So there was a lot of WPI was there, and Clark University, I think too, was nearby. So yeah, so everyone was just pretty much in school mode all the time. Yeah, that's pretty much it. Yeah. Oh, what is your favorite memory of med school? The people, my classmates, I miss them. Like, because I had to move back to Canada. I was the only, like, I think there was like a handful of Canadian students. Most of them were from Ontario. I'm from BC, which is the West Coast. So my friends, I miss that. Yeah, I would say that's what I miss out there. But in med school in general, I think I mean, it was very stressful at times, but I am grateful for some of the professors there, and just the skills, like learning the skills and proficiency. Like some people are not very good about the tactile. Like some people are super book smart when it comes to med school or optometry school, but maybe skill wise they struggle with. I was like probably like book smart. Like I really take me like longer, but like with the skill, I picked it up really quick. So that's where I miss kind of doing those. I know some people would probably hate doing proficiency. I actually kind of enjoyed that process and mentally preparing yourself and, you know, getting yourself pumped up and just doing the skill. Yeah, I really like that. I just had a question. Who's thinking of optometry school in this group here? I'm more curious. Yeah. Okay. Okay. Are there any books or shows or podcasts you watch in regards to your field? Not books or shows. There's some podcasts. There's this one. He's pretty good. He's a BC guy. His name's Harbier, Dr. Harbier Cyan. His podcast is called 2020. So I'll watch some of his clips on. I think I spend probably more time on like Instagram and watching those kind of feeds. So there's some Instagram pages that I do follow, a lot of ophthalmologist pages that I do follow just to kind of catch up on the latest and greatest. But yeah, Harbier Cyan, his is pretty good too. It's called 2020 podcast. It's good. But I wouldn't say I religiously listen to a lot of medical podcasts. Sometimes I just like to take a break as well. Any tips for incoming optometry students? Just take it day by day. I think, the first year usually generally goes by okay. Second year is going to be a little bit more of a bumpy ride. Make sure you make good group of friends. I think that's super important. So the people that are more on your level and are, just like, that if you have that good group of core, that they'll make the difference. And get to know your professors. Like, don't be afraid. Like, that's what I did. And I think that came a long way. And I would also recommend that anytime you get a test, and they said you can go review your test with that professor, because that way they see you individually and see how your reaction, what your thought process is, instead of like, you might think, oh, I didn't perform that well, I don't want to go see professor so and so, they're going to think I'm dumb. But if you actually go and kind of talk it, whether you did good or bad, either or, you should go. And that way they kind of see what your thought process, and that's another way of them kind of engaging and seeing you. And again, building that reference and getting that reference letter good. Because if you're wanting to go to residency after optometry school, you still need references. And in undergrad, you should go review your test with your professor, because that way they'll have that nice connection with you. That's one thing I did, and I think it worked out really well for me. What do you like to do for fun, and when you're not in the office and when you're not in the class? Yeah, So I do like to run. I like being active. That's probably right now. It's been super hard for me to kind of like spare some time. So I've been busy with my clinic, but yeah, I usually just like to be active, run, play soccer. I've been picking up tennis now. Tennis is a little challenging of a sport, but yeah, just kind of be active. I like watching really trashy reality shows, unfortunately, but yeah, I do that type of stuff too. Is it to manage relationships in school, or can you get too occupied? Is it made to manage? I don't know what relationships in terms of like long distance relationship. I never had one during optometry school, so I was kind of lucky. But for some of those that did, some were able to manage really well, some didn't. Is it easy to manage? I think sometimes I would say the biggest challenge is when you leave for school, for optometry school, whether it's near or far, sometimes your friends that you had at home may not understand why you can't call them or text them right away. So that's why there might be a little bit of a gap. Whereas in terms of long distance relationship, I would say from my classmates that I saw, like it was really a challenge and they would really have to put time and effort into it. I think it can be done. Sometimes, unfortunately, it didn't work out for them. Some it did. But I would say the biggest thing relationship wise changed for me is my friendship. More of my friends that I had locally, it just changed versus the friends I made in optometry school were longer lasting. Would you say you were able to have fun and study in med school? Fun, like we would try to have, like I didn't go out like crazy and party, to be honest. I'm not that type of person, but we would try to have like our little nights in and just hang out with our friends. But I think we were always I personally, I will say, I was always so stressed and like, oh my gosh, and just wanting to do good, or and a lot of times, like my roommates and my friends were I felt like a lot smarter than I was. Like I just felt like I had to work 10 times harder. So like for them, they could probably just read it once and it's in their brain. For me, like it would take me a long time. So I think and also that's another thing is don't worry about other people, how they're studying or what they're doing. Just focus on yourself. Because the moment you start to look out that way and see, oh, well, they're like having fun and I had to study, don't do it. Just focus on yourself. Everyone studies differently. So do that. How did you take care of your mental health during school? That's a very good question. Mental health was super important. I would say I never was really homesick, so I didn't really have to feel that. If anything, I just felt that with my group of friends being such high performers, I felt very less than, and I was really hard on myself. So I would sometimes not sleep because I'm like, I need to study more than that because I'm not going to know anything. Or sometimes like I didn't eat properly, which was not good either. So I did like lose like some weight, which was not good. So I would say then there was this one semester I just kind of switched and just made a schedule for myself. And I had to just tell myself this schedule and this routine is for you and only you. What they do is what they do, and you cannot compare the two. Like that's probably just put your blinders on and just focus on yourself. And when you start doing, I had to kind of go back to like things that I used to do in high school, because high school I really excelled at. I felt like I had the good group. And so when I'm like, what did I do in high school? I had the confidence, I took care of myself, and I had a schedule. And so I kind of implemented those skills back because I somehow forgot it when I went in undergrad. And so when I brought it back to grad school, I performed a lot better. Being a teacher's pet, sure, I did that then, and it worked out great. So mental health is huge, especially if you're moving away for grad school. That's going to play, especially if you get, homesick and sometimes you miss certain events, like you can't fly in and out of. That's going to play a toll. But I would say I never was really too bothered about that. Like I really never got homesick. Sometimes, like, yeah, I would be like, oh, I wish, I had a home cooked meal. But that really, it was just more so the wishing, thinking, am I good enough to be in this program? That was a huge thing for me. But good question. How many hours on average do you work? Well, now I'll say longer, but sometimes it's not as busier because even when my clinic hours are done, I'm still like in the clinic just doing a lot of paperwork stuff. So my office hours for the clinic is Monday to Friday, 10 to 6, Saturday, 10 to 4. But then usually like 10 to 6, depending, I might have to go to a meeting or just kind of stay in the clinic and do some paperwork. So when you have a business, to be honest, it's 24/7. Like that's all you're thinking about. You have emails. Like I wake up to like, I don't know, 20, 30 emails every morning, just small stuff. But yeah, so I think on average, those are the hours that I work. But then I think when you own a business, it's 24/7. You can't not but help but think about it. Would you have done anything differently if you could? Great question. I think I probably would have, although I'm happy with the school that I went to, I think I would have researched more schools I didn't think about. Like I had like Houston, like I loved my Houston rotation, and this they have two optometry schools there. I don't know, for some reason I just didn't think of applying there, and I wish like I would have, because I loved living. Like there's certain schools that you may not think you want to go to. Like I just my two were like I want to stay in like California where the weather's nicer, or the schools that like the optometrist I work with where they went to, like Chicago or Boston or Oregon. Oregon, I visited the campus. I was just like, not for me. I'm like, if anything, I would want to go somewhere like sunny. Although I went to Boston, which gets super cold, so it's not like it's super sunny there anyways, but they have good schools there. So I think if anything, I would do more research on other schools. Maybe that's not on your radar. You'd be surprised at what you could find. But yeah, I would, yeah, do more research on the schools that you're applying to. And then maybe they'll change in what they offer might intrigue you. So that's probably what I would change, just not limited the schools I was applying to, just kind of looking at all of them and seeing, because you'd be surprised at the connections you make in certain areas and what the people, and you're really meant to kind of be there. Any last comments or recommend as you come? Is that for me or for you?
Yes. Or everybody in general. If you have any last questions,
Yeah.
comments, or questions in general, we start doing the wrapper presentations at 11:25. So this is your chance.
Otherwise, I can show you some cool optometry equipment stuff if you guys want. That might be kind of cool. Okay. All right. Yes. Okay. 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 That's cool. All right. So this is Algar brush. I don't know if you'll be able to see it, but if I turn it, it kind of vibrates. Hopefully the battery's not dead. Yeah, there you go. You can't really tell it vibrates, but it does vibrate. And it's super, super small. So what we use this for is to remove any kind of foreign body that might be embedded in the cornea. So it's kind of nice because it cleans it up. Actually, we use that after, or remove any kind of rustering. I like to use, I have this one is called a golf spud. So I'll usually remove that and then use this one with it vibrates a little bit and to scoop it out. But what's great about this, it has a sensor, so it's not going to penetrate super deep. It only hits a certain layer, because obviously if you go a little bit deeper in the cornea, it's going to scar, which we don't want. So it kind of has that resistance, so it wouldn't even let you kind of go like super deep in the cornea. So I usually use this first to kind of remove it. Some people will use like a tweezer, but this is a little bit easier because tweezers can get kind of sharp, like, it's pretty sharp. So I just use a golf spud, and then I'll use this to kind of remove any kind of the rustering. So that's kind of cool. That's what I have here. And then, oh yeah, okay. So I have these lenses. I'll start with this one. So are those technical surgical purposes? I think the kit that I have, that was one thing good about my school. They kind of gave us all, it came with the tuition, but so I have a lot of like surgical equipment in here. But I honestly don't use all of it. I think it just came with the package. But it's not like I do heavy surgery. We're not even like with the bylaws that we have to follow with the BC Optometry. Like even if a piece of metal is embedded super central in the cornea, technically we can't even remove it. In the States, you could, but in BC, it has to be sent to an ophthalmologist. It's just the governing body that we have. We're kind of restricted in our scope of practice in some degrees, whereas in the States, each state is quite different, and optometrists can do a little bit more or a little bit less. But yeah, I have a lot of like crazy, like, what else do I have? I don't really use this one. This one is kind of cool. This one, yeah, so I have some like small little, maybe that's a heavy procedural stuff, but I don't really use it. This one here, there's like a little thinner end and a thicker end. And that basically, we have a puncta in here where your tears drain into. So if people have smaller puncta, we might just kind of open it up and put like a plug there, or just kind of open it up here. So that's what I use that for. But to be honest, the two instruments that I use is the golf spud to remove it and the Algar brush. That's probably what it is. And then I have this lens. So we have this whole case of lenses, and I'll just kind of go over it. So there's 3 that I use mostly. So this one's called a 90 lens. It helps magnify. So when I look in the slit lamp, I put this in front of the eyes, and it helps magnify the retina, the nerve, the vessels. And this one is a 78 and magnifies it even more. And you can kind of see it flips the image. See how I'm upside down? So it flips it and inverts the image. And this one is a 20D lens. This is the one that we use when we have that big kind of helmet on to help see in the periphery of the retina. And sometimes I'll use it on kids, like just to magnify their eyes if I can't get them in the slit lamp. So we use those tools. This is the gonio. There's a 4 mirror and a 3 mirror. And basically this kind of goes on the eye like this, so we can see the anterior chamber to see if there's any angle closure for glaucoma or any other kind of, if the pressures are kind of high, we would use this to be like, why is the pressures high? Is it, are their angles quite narrow? If we do see narrow angles on the slit lamp, we'll kind of use this to see which in the anterior chamber, which how narrow is it? Is it a grade 1, grade 2, grade 3, or grade 4? So yeah, so those are some of the tools that we kind of use. If anything, I probably use the 3 magnifiers, like the 90 or 78 and 20 lenses. The gonio lens, I don't really use it as much, to be honest, because if I do see narrow angles, I usually just send it to ophthalmology and they do further testing. Not that I don't want to, it's just really kind of uncomfortable for a patient, and I want my patients to like me and not, put them through that torture. Yeah. I have, what else do I have here? Yeah, we have some drops that are used to, actually, this is a product that I'm trying to carry here. It's called the 2020. It's actually states they help with lash serum growth, so that's kind of nice. I usually keep a little bit of eye drops here. This is iMed. This is a Canadian company that we have some drops that we sell. So I don't like to be heavy salesy, I guess you could say, but I do have the drops available. I have it on my desk, so if patients ask about it, I can educate them on it. And then I also have these drops. The Alkane is an anesthetic drop that we use when checking pressures. It numbs the eye, or also removing any kind of foreign body, we'll use Alkane, just like an anesthetic. Usually lasts about 10 to 15 minutes, just to help make the patient comfortable, so I can remove the lens or remove the foreign body, because the cornea is super sensitive. So even as you go in, if they don't have any numbing stuff, they're going to keep blinking it and make it very difficult. The Mydrocel is basically dilation drops. We have different percentages for different things, for how long they last or how big I want the dilation. But yeah, so, that's pretty, yeah, you saw all the cool stuff with the phoropter. I have a lot of little kid stuff that I had from school, but that's, pretty much it. You saw the here, yeah.
Thank you so much. So we're gonna go ahead and share I don't know why my screen looks like this. I apologize for that. I'm gonna go ahead and share my wrap-up presentation, and we have 2 minutes left. Let me just quickly accept all cookies, and then, all right, I'll be sharing my screen. All right. So once again, thank you all for making the time. Thank you, Dr. Mann, for making the time and coming to our organization today to help us out. I'm just trying to, oh my god, how do I, there we go. Okay, So let's reflect. What brought you guys to the session today? What are 3 major takeaways you got from this presentation? And what do you want to learn more about? You can put that in the chat. Once again, if you want some recognition, whether it be articles, reflections, reviews, or success stories, you can go ahead and submit them on the blog submissions part of our website. It looks great on your resumes. And if you're interested in being part of pre-health shadowing, you can go to our website and you can click the volunteer tab or to join our team tab, and you should be able to see our application and you can apply. We're always looking for volunteers, and we're currently looking for members as well. And I mentioned this at the beginning of our presentation as well, but we do solely run off of the time of our volunteers as well as the donations we receive, so I would highly appreciate if any of you guys can donate. Our QR code is right over there, so we just need to scan this. And if you want to go ahead and get your digital certificate, the simple 10-question multiple choice quiz is actually up right now, and you just have 2 chances, and you need to pass with at least a 70% or higher to get your verification, which is a certificate, and it looks something like this. And if you missed any part of the session today, you can go ahead and visit our YouTube channel at Pre-Health Shadowing to watch any of our previous sessions for free, and this video will also be uploading soon today. And make sure to catch up on our sessions every week by signing up to our email list and checking our website frequently. See you guys next time. Thank you so much for joining. If you have any questions, feel free to stick around and ask our student team.
Thank you, everyone. Thank you. Hopefully it was informative.
You were great. It was amazing.